So Smith fracture is also the extra-articular, it is the extra-articular fracture of the distal radius, that means the same component at corticocancellous junction. That means if you compare the definition till this point with the Colles, it is exactly the same. But what is the difference? There it was dorsally displaced, here it is ventrally displaced. So with ventral displacement, so this is what, or this is how Smith fractures are defined, with ventral displacement. So dorsal displacement was seen in case of Colles fracture. Ventral displacement is the component of a Smith fracture, and this is the reason why Smith fracture is also known by the name of, it is also known as reverse Colles fractures, also known by the name of reverse Colles fracture. Alright. Now as far as the treatment is concerned, or you can say the differences in between the Colles and the Smith, one of the difference is in the definition. Then the second difference is the age group which is likely to be affected is young males. You see, Colles fracture was commoner in case of elderly female, while Smith fracture is more common in case of young male. And the management for minimally displaced Smith fracture is achieved by closed reduction and above elbow cast immobilization. You see, in Colles fracture, the cast was applied below the level of the elbow. But in Smith fracture, the cast is immobilized above the level of elbow. And what is the position of wrist for immobilization? Immobilization in supination and extension of the wrist. Alright. If you look at the cast of the Smith, it is immobilized in supination and with the extension of the wrist. While in case of Colles, it was immobilized in pronation, flexion and ulnar deviation. Here it is immobilized in extension and extension of the wrist. Extension and supination of the wrist. Then why above elbow? Why not below the level of elbow? Because in order to relax the brachioradialis muscle. You know, this ventral displacement is because of the contraction, is because of the pull by brachioradialis. Brachioradialis is taking up the origin above the level of elbow. So this also need to be immobilized in order to hold the fragment reduced. That is why above elbow cast is required. Although highly unlikely that examiner will go to an extent of asking that basic why above elbow cast is. They might just ask you what are the differences in between the Smith cast and the Colles cast. So hope everything is clear related to this topic in particular, or the differences in between Smith and Colles. Now as far as the intra-articular fractures of the distal end of the radius are concerned, you know, the two fractures that we have talked about, Colles as well as Smith, both were extra-articular. Alright. Although there are variations also, practically you will see Colles also having some intra-articular extension, Smith also having some intra-articular extension, but those are neglected for examination purposes. Now, practically all intra-articular fractures, whatever the displacement is or irrespective of the displacement, intra-articular fracture of distal radius are called as Barton fracture. So what is Barton fracture? It is intra-articular fracture of distal radius. That means extending all the way up to the level of the joint. Intra-articular fractures of the distal end of the radius are called by the name of Barton's fracture. Now, in case of Barton's fracture, the treatment, yes, management is always achieved by open or closed. Meaning in some of the cases, in very limited number of the cases, the reduction can be achieved by closed means, but majority of the time you have to go for open reduction and internal fixation. You cannot manage a Barton fracture successfully. Union will be achieved, but with complications. So management has to be achieved by open reduction and internal fixation, either in the form of a plate or in the form of the wires. Alright. So pre-contoured plates are available like we have done in case of distal end of the radius fracture, which was intra-articularly extended. So open reduction internal fixation is the management protocol for the Barton's fracture. So hopefully you came to know everything related to the fractures of the distal end of the radius. Now there are two eponymous fractures also which we are going to talk at the end. Like one is Schaffer's fracture, other one is the Bennett fracture, but we are going to have a discussion of these later. But at this point of time, it was important to have a discussion on Colles, the Smith, as well as Barton's fracture. All of them are fracture of the distal end of the radius and how they are different from each other. So having this much of the anatomical aspects cleared related to elbow joint, that means orthopedically significant anatomy that we have already discussed. Now is the time to have a discussion on the pathological aspects, all right, related to the elbow. So first topic, or to begin with, the next very important topic is supracondylar fractures of the humerus. Now before we talk anything related to that fracture in particular, let's have a discussion or just visualization of the sample questions. Now the first sample question which is there over the screen is that what are the common displacements which are observed in supracondylar fracture of the humerus? All right, so here it has been converted into a question that all of the following are the displacements except. So we should know what are the displacements that are meant to happen in case of supracondylar fractures of the humerus. Then which of the following is the most common nerve injury associated with supracondylar fracture of the humerus? A very commonly asked question in relation to this fracture in particular. Then three bony point relationship which we have already discussed in the anatomical perspective is maintained in which of the following fracture around the elbow joint? Alright, then 3-year-old child who has sustained injury to his right elbow, there was a swelling and absent distal radial pulse. What is the next step for the management of the child who presented with these kind of situations? Alright, so all these sample questions are there in accordance to the topic, that is supracondylar fractures of the humerus. Now first of all is the age which has been mentioned. Now this is the kind of the fracture which is more common in case of boys, particularly in the age group of 2 to 5 years. All right, so 2 to 5 years of age is the most common age to be affected in particular. Now you will ask, why is it so very common in case of boys in this age group? You see, what happens is that in this age group, a child, particularly a male child, is extremely playful. He is climbing the stairs, he is climbing the tree and falling from the tree with the extended elbow, with the outstretched arm, results in the fracture around the elbow joint. That is supracondylar fracture of the humerus. So what is the mechanism? It is the fall on abducted and externally rotated arm, that means outstretched hand. But at the same time, you also have to mention that what was the position of the elbow joint at the time of impact. The position of the elbow was extension, with extension of elbow. All right, so this is the mechanism. So fall on outstretched hand is the mechanism of injury for supracondylar fractures of the humerus. Now what are the types of displacements which are likely to happen in case of supracondylar fractures of the humerus? Now before we talk anything related to the displacement factor, just let's have a discussion of what is displacement in common. Let's have a discussion of what exactly is the displacement in orthopedics. All right. Now just try to understand or imagine this as, imagine this is a bone and this got, after getting fractured, there is a displacement of a sort. That means the distal fragment and proximal fragment are no more in relation to each other and there is a displacement at the fracture site. Now, if you consider this bone, for example, this is the medial part and this is the lateral part. So there are two ways of describing the displacement. One is that the distal fragment is displaced medially in relation to the proximal fragment. All right, that the distal has been displaced medially in relation to the proximal fragment. Other way of describing the displacement is that the proximal fragment is displaced laterally. The proximal fragment is displaced laterally in relation to the distal fragment. Now, in order to define the displacement, the statement will become too long. Like, first you have to describe that which sector is getting displaced in relation to the other fragment. In order to cut short this statement in total, there is a universal law is that we are going to quantify the displacement, or we are going to talk about the displacement in relation to the distal fragment only. So how this statement is going to be shortened? that the distal fragment is displaced medially, or you can say that the fracture, there is a medial displacement. So this entire line would be converted into a single statement or the single word, that is either medial or lateral, proximal or distal, anterior or posterior. Hope you have understood what I am trying to say. That whenever we talk about the displacements, it is always going to be the distal fragment. In whatever direction it is getting displaced, that is going to be accounted for the displacement for that particular fracture. Alright. So if I say in future, for example, that in supracondylar fractures of the humerus, the displacement is posterior. What does it mean? That the distal fragment is getting displaced posteriorly. Alright. Like if I say that in fracture shaft of femur, the displacement is medial and posterior. That means that the distal fragment is medially and posteriorly displaced. Alright. So this is something that you have to understand. It is universally applicable for all the fractures and dislocations in orthopedics. Now we can talk about the displacements in supracondylar fractures of the humerus. You see, the displacements in supracondylar fractures of the humerus can happen in anteroposterior plane. So you see, the posterior displacement is far more common in comparison to the anterior one. Actually, 98% of all the supracondylar fractures are posteriorly displaced. Alright, only 2 or less than 2%, because some of the fractures are undisplaced also. So 2 or less than 2% of the fractures are displaced either anteriorly or are undisplaced. Alright, now there could be a displacement in mediolateral planes also. For example, just try to understand. If this is the fracture that we are talking about, this is the distal end of the humerus and this is the supracondylar region. Alright, now the displacement could be in the posterior-anterior planes. This is one displacement. That is a possibility. Another possibility is mediolateral. That in which plane the displacement is more likely to happen. So the medial displacement is far more common in comparison to the lateral one. Alright. So the two displacement that we have already talked about, one is posterior, other one is medial. Now you might have seen the word written as like medial tilt. You see, if the distal fragment is getting tilted medially, it would be called as medial tilt. If it is shifted medially, it will be called as medial shift. If it is drifted medially, then it would be called as medial drift. So what you have to more importantly remember is that what is the plane in which it is getting displaced. Alright. Rest of the things are just the layman terminology of the kind of the displacement that supracondylar fracture can have. So one is posterior, other one is medial. Now the third possibility is rotation. There is also a possibility that the distal fragment could be rotated. Internal rotation or external rotation. So which one is commoner? It is internal rotation. Internal or medial rotation is far more common in comparison to the external rotation. Alright, so these are the displacements in supracondylar fracture of the humerus. And then finally, the fourth point is impaction. Once there is a fracture, there is a possibility that these two fragments could be accreted to each other. They could be impacted to each other. So the fourth possibility is that of impaction or attrition. So hope you have understood everything related to the topic. In particular, these were the displacements, or these are the likes of the displacements that can happen in supracondylar fracture of the humerus. So if we go back to the one, you came to know age. Why is it common in this age group? Because of extremely playful activities where the patients or where the children are more prone to fall from height with the impact on outstretched hand. So mechanism you have understood, and the types of displacements that we have already talked about. Now is the classification system. You see, because supracondylar fracture of the humerus is a common topic to be asked, and there is also a possibility that the examiner might ask you about the classification system also. So the classification for supracondylar fractures of the humerus is Gartland, G-A-R-T-L-A-N-D. That is Gartland classification. And according to this classification, the supracondylar fractures could be categorized into three types. The type 1 is the type 1, type 2 and type 3.